The hypothalamus releases gonadotropin-releasing hormone, or GnRH, in pulses every 60 to 90 minutes to stimulate the pulsatile release of luteinizing hormone, LH, from the pituitary gland into the bloodstream. LH binds the LH receptor on the Leydig cells of the testes. Binding initiates a cascade of events, which include the conversion of cholesterol, depicted as LDL here, to pregnenolone, followed by a series of reactions, which convert pregnenolone to testosterone. Testosterone, secreted by the testes, diffuses into the peripheral circulation to be carried to target tissues. In liver, muscle, and adipose tissue, testosterone binds directly to its androgen receptor, or AR, to exert its biological effect. In skin, hair, the prostate gland, and gonadal tissue, testosterone must be converted to dihydrotestosterone, or DHT, by 5-alpha reductase in order to bind the androgen receptor. In bone and brain, testosterone is converted by aromatization to estradiol, or E2, which binds the estrogen receptor, E2R, to carry out its effects.
Welcome to the channel. Today we'll discuss about the benefits of Eurycoma longifolia, commonly known as Tongkat Ali, a herbal plant native to Southeast Asia, particularly Malaysia and Indonesia, traditionally used in folk medicine in boosting naturally testosterone both in hypogonadism and low testosterone level in adult men. Let me introduce the benefits of Eurycoma longifolia that has gained attention in modern science for its potential to enhance male health, specifically in increasing testosterone levels. Testosterone, the primary male sex hormone, plays a crucial role in maintaining muscle mass, bone density, and overall vitality. As men age, natural testosterone levels tend to decline, leading to a range of health issues such as decreased energy, reduced libido, and impaired cognitive function. Eurycoma longifolia is believed to counteract these effects through several mechanisms, making it a popular natural supplement for those seeking to improve their hormonal health and overall well-being. This introduction will explore the scientific evidence supporting Eurycoma longifolia's efficacy in boosting testosterone levels and its broader implications for male health. Male hypogonadism is a clinical disorder that arises from a failure of the testes to produce adequate levels of testosterone, mainly mediated through a disruption of the hypothalamic pituitary gonadal (HPG) axis. Hypogonadism is estimated to affect 1.2 to 12.8% of middle-aged and older men in the general population, with increasing incidence and burden on healthcare services. The biochemical definition of hypogonadism remains unclear, however, a 300-DL threshold has been generally recommended as the lowest limit of normal, with general consensus that testosterone levels above 350-DL do not require treatment. Conversely, patients with testosterone levels less than 230-DL usually benefit from testosterone replacement therapy, TRT. Hypogonadism is further classified based on gonadotropin levels as primary, hypergonadotropic, or secondary, hypergonadotropic. Common clinical features of hypogonadism include reduced libido and erectile dysfunction, male factor infertility, obesity with reduced lean body mass, reduced bone density, fatigue, and depression. Lower levels of testosterone in healthy men is a predictor of comorbidities such as obesity, metabolic syndrome, type 2 diabetes mellitus, cardiovascular disease, and osteoporosis. Clinically, management of hypogonadism is focused on TRT that can improve sexual dysfunction and well-being, reduce obesity, increase lean body mass, and increase bone density. Although TRT has become a multi-million-dollar market, only about 10% of men with hypogonadism in the USA and Europe are being treated with TRT. Furthermore, TRT is contraindicated in patients who want to preserve fertility in those with prostate carcinoma, benign prostatic hyperplasia and/or lower urinary tract symptoms, high serum prostatic-specific antigen (PSA) levels, obstructive sleep apnea, or patients with a history of myocardial or cerebrovascular stroke. The benefits compared to risks of long-term TRT remain unclear in men treated for mild hypogonadism or age-related hypogonadism. Hence, many physicians perceive the risks of TRT to be high. Numerous herbal medicines have shown potential to increase serum testosterone levels and benefit sexual function and fertility. In particular, Eurycoma longifolia Jack, Tongkat Ali or Malaysian ginseng, has been traditionally used for management of male sexual dysfunction and infertility. In addition, longifolia also possesses other medical properties, such as positively impacting athletic performance and muscular bulk, reducing adiposity, stimulating appetite, and treating fatigue, malaria, diabetes, anxiety, osteoporosis, cancer, constipation, and peptic ulcers. Longifolia is reported to improve libido and is being used as a common ingredient in more than 700 herbal or nutraceutical products marketed as aphrodisiacs. Recent systematic reviews have summarized the benefits of longifolia to men's reproductive health. However, it remains unclear whether longifolia improves serum testosterone levels in men. With a high burden of hypogonadism in the general population, longifolia may provide benefit in increasing serum testosterone in men. Therefore, this study aims to investigate the efficacy of longifolia to increase testosterone in males, using a meta-analysis of available randomized clinical trials. Longifolia was investigated primarily as a commercial water-extracted product, Vista, Biotropics, Berhad, Kuala Lumpur, Malaysia, in 7 of the 9 studies included, with variable dosages from 100 to 600 mg per daily for a minimum of 3 days to a maximum of 6 months. Results presents an increased testosterone levels in both groups of men with testosterone less than 300 ng/dl, and without hypogonadism, testosterone greater than 300 ng/dl, after longifolia supplementation, although the increase was significant in the hypogonadism group. Heterogeneity was noticed among the studies in both groups. Furthermore, longifolia may lead to increased osteoblast proliferation and apoptosis of osteoclasts. This reduces bone loss in osteoporosis, and thus, it can be considered as an alternative to TRT in these patients. This systematic review highlights the beneficial use of longifolia supplementation to enhance testosterone levels, particularly in those men suffering from hypogonadism. Most of the studies included in this systematic review utilize the same commercial, freeze-dried water extract of longifolia root standardized to 0.8 to 1.5% eurycomanone. Longifolia, predominantly the roots, contains active constituents such as quasinoids, quasinoid diterpenoids, xanthin, 6-1 alkaloids, beta-carboline alkaloids, squalene derivatives, triterpene-type tyrocalane, tyrocalane-type triterpenes, lauricolactone, and bioactive steroids. Derivatives of quasinoids, a group of physiologically active diterpenoids, are further classified as eurycomanones, eurycomanols, eurycomalactones, eurycolactones, eurycomanosyl, and eurycomaicides. These molecules have shown inhibitory functions in vivo and in vitro, particularly anti-inflammatory, antiviral, antimalarial, and antiproliferative activities. Quasinoids present in longifolia also contribute towards ergogenic effects, including increased muscle strength and endurance in cycling time, along with anxiolytic properties. Eurycomanone derivatives reportedly increase testosterone levels and have antiestrogenic activity, improving spermatogenesis. Animal studies reported higher release of luteinizing hormone, LH, and follicle-stimulating hormone, FSH, gonadotropins, resulting in increased testosterone production in the Leydig cells. In addition, there may be inhibition of the aromatase enzyme, which limits its conversion to estrogen after longifolia supplementation. The proprietary extraction of longifolia has also been shown to improve semen quality in infertile males over 9 months, alongside an increase in spontaneous pregnancy. Similarly, a polyherbal formulation that included longifolia improved semen volume, sperm concentration, and motility after 90 days in oligosospermic males, alongside improved serum hormone levels compared to placebo. In addition to semen quality, E. longifolia, along with polygona minus, improved the erection hardness scale, the aging male symptom scale, and the sexual health inventory as per the diaries of men, suggesting its possible use for the treatment of male infertility. In conclusion, this systematic analysis of the literature highlights the possible use of E. longifolia supplementation for enhancing testosterone production. Although more research is required before its use in clinical practice, this may represent a safe and promising therapeutic option, particularly for patients with hypogonadism. The following supporting information can be downloaded at https://www.mdpi.com. Thanks for watching. Follow the channel for more videos.